it's me Javeria Jobin and welcome to my YouTube channel. Here I am going to discuss the anatomy of humerus bone, and then we will have the fractures of the humerus bone, and another one we will discuss about a quiz for the self-analysis. Number 1, anatomy of the humerus bone. Humerus is a long bone of our upper limb and it is present on the upper part of arm. Humerus has two parts, epiphysis and diaphysis. Epiphysis are the ends of the humerus bone and diaphysis is the cylindrical shaft of the humerus bone. There are two ends of the humerus bone. One is the proximal end and another one is the distal end, and there is a cylindrical shaft of the humerus bone which is called diaphysis. So we will discuss them in the sequential way. Number 1, proximal epiphysis, then diaphysis, and then distal epiphysis. The proximal epiphysis of the humerus bone has a head, a large rounded head which is present medially, and it attaches with the glenoid cavity on the lateral end of scapula. I have also discussed the anatomy of the scapula, and I will give you the link in the description. So the head of the humerus bone is present medially there, and on the border of the head there is a lean border which is called anatomical neck, and below anatomical neck there is a surgical neck, and this is the proximal epiphysis, on which head of the humerus, anatomical neck of the humerus, and then surgical neck of the humerus. Second one is the diaphysis of the humerus bone. There is a large raised projection which is called greater tubercle, and there is a small raised projection which is called lesser tubercle, and between greater and lesser tubercle there is a groove and a depression which is called intertubercle groove or intertubercle sulcus, and there is also a raised or a rough surface for the attachment of the deltoid muscles, and this is called deltoid tuberosity. Deltoid tuberosity is present on the lateral side of the humerus. Number 3 is distal epiphysis, and distal epiphysis has on the distal epiphysis there are two condyles. Condyles are small articular surfaces, these are small rounded articular surfaces, and these are called condyles. Above condyles there are small projections, pointed projections, which are called epicondyles. Condyles and epicondyles are present in the pair, mean a medial condyle and a medial epicondyle, a lateral condyle and a lateral epicondyle, and between the epicondyles there is a small rounded surface, small rounded structure which is called capitulum. Beside the capitulum there is a hook-like structure which is called trochlea. The capitulum is present on the anterior side of the humerus, and trochlea is present on the anterior and posterior side of the humerus. It is a hook-like structure which is visible from both anterior and posterior side. This is the anterior, and this is the posterior side. And then there is a small depression or groove above capitulum which is called radial fossa, and above the trochlea there is a small depression and groove which is called coronoid fossa, and on the posterior surface of the humerus there is a large groove and depression which is called olecranon fossa. This is all about the anatomy of the humerus bone. So let's come to summarize all these topics. Number 1, the humerus has two structures, epiphysis and diaphysis. Proximal epiphysis upper end, distal epiphysis lower end, and then diaphysis which is a cylindrical shaft. The proximal epiphysis has head of the humerus, surgical neck and anatomical neck, and then diaphysis has greater tubercle, lesser tubercle, and intertubercle groove or intertubercle sulcus, and the deltoid tuberosity. And then distal epiphysis has condyles and epicondyles which are present in the pair, lateral and medial epicondyles and lateral and medial condyles, and then capitulum, and then trochlea. Above the capitulum there is a radial fossa, of the trochlea there is coronoid fossa on the anterior surface, and on the posterior surface there is a large groove and depression which is called olecranon fossa. Now discuss the fractures of the humerus. The humerus has the most common fracture is the fracture of the surgical neck, because surgical neck is the most sensitive part of the humerus bone, and this is the most common fracture, the fracture of the surgical neck and the fracture of the shaft. On the mid of the diaphysis there is sometimes an injury or a broken humerus which is called the fracture of the shaft of the humerus. And thank you so much. I hope that that this video is helpful for you. Let's have a quiz for self-analysis. Question number 1 is, on which part of the humerus deltoid muscles insert? And the answer is on the deltoid tuberosity of the humerus bone. Question number 2, which fossa is present on the posterior side of the humerus? And the answer is olecranon fossa. Question number 3, the head of the humerus lies option A medially, option B laterally, option C anteriorly, and option D posteriorly. And the answer is medially at the proximal epiphysis. Thank you so much. I hope that this video is helpful for you. So must like, share and subscribe. See you in the next video. Allah Hafiz.